Miss Abdallah, I can take you in for your x-ray. Hi, if you just have a seat right there for me, please. So my name's Caroline. I'm going to be your technologist today. Can I just confirm your name and date of birth?
Jessica Abdallah, 32891.
Okay, can I just verify here? Okay, perfect. So I see that your doctor ordered some x-rays of your spine today. Can I just ask what happened?
Well, it's kind of an embarrassing story. Well, I have 3 cats.
Okay.
I went to the fridge at like 3 in the morning. I know I shouldn't be eating pie at 3 in the morning, but it just looked so good. So right when I opened the fridge, my cat just popped out of nowhere and I tripped over her.
Oh gosh.
Yeah.
Okay. So
happened about like a month ago.
Okay, does anything help the pain at all?
No, not really.
Okay. So just to ask before we do get started, is there any chance you can be pregnant at all?
I have 3 cats, so no.
Okay, perfect. So I'm just gonna have you quickly go change in the other room. So I just need you to remove any undergarments or any jewelry that you do have on. So if you just want to follow me, I will show you where you can change. Okay, so I'm just gonna get my room ready for the patient's exam. So we're gonna use a 14 by 17 for the first AP image of our T-spine. Our tube needs to be at 40 inches, which we're at, and then our tube is also in detent. So we can call our patient back in now and we're ready to start. Hi Jessica, we're gonna take your first image. So I'm just gonna have you lay down on your back there for me. Just watch your head.
Oh no, is that thing gonna squish me?
Nope, you're good. Don't worry, we're not gonna go any lower than this. Okay, so I'm just gonna make sure that you are straight here. Just gonna move your legs over slightly, okay? Okay.
Should I not move?
If you could stay as still as possible, that'd be great. Can you just slightly bend your knees though for me? It'll make it a bit more comfortable for you. Is it okay if I just touch your neck for 1 second?
A 14 by 17 inch cassette with a grid should be used at 40 inches SID, centered at T7. This can be found anteriorly 3 to 4 inches below the jugular notch.
Okay, so just before we take the image, I'm just going to move this.
Ensure the mid-sagittal line is centered to the table and tube. Collimate left and right to focus on the
Make sure
spine.
you're still centered here. Okay, I'm just going to place a left marker on you. Okay. I'm just going to put this over your lap here for you. So stay as still as possible for me. So I'm just going to have you breathe in, breathe out, and then hold, please. Okay. So breathe in, breathe out, and hold. On here and click AP T-spine. So we're going to use an 80 kV with 11 mass for our first image. X-ray. Okay, Jessica, we're on our second out of 3 images. So I'm just going to remove this really quick. Just going to leave this here. So I'm just going to have you roll over on your left side for me.
Okay.
Yes, that is perfect. You just want to put your hands together like you're praying. Perfect.
Well, we pray like this.
Okay, well, can you just put them together for me?
Okay.
Perfect. Is it okay if I just feel the back of your neck for a second?
Mm-hmm.
Okay.
For the lateral T-spine, use a 14 by 17 inch cassette with a grid at 40 inches SID.
I'm just going to move the table, so just hang tight here for 1 second.
A lead mat can be placed behind the patient on the table
Okay,
to absorb
make sure you're
scatter.
perfectly straight here. You're doing good. We're almost done.
Like the AP T-spine, align the CR to the spine at the level of T7. Again, collimate left and right to focus on the spine.
So same instructions as before. I'm going to have you breathe in, breathe out, and hold. Again, please stay as still as possible. Okay, Jessica, breathe in for me. Breathe out and hold. Okay, for our next image, we're going to use lateral T-spine. So we're going to use 100 kV at 66 mass. X-ray. Okay, Jessica, we're just going to take our last image and then you'll be on your way. So with your left arm, reach up as high as possible for me. Perfect. Then with this right arm, I'm just going to have you reach down for your toes. I'm just going to cover this up for you. Is that comfortable? Mm-hmm. Okay.
For the swimmer's view, it is best to use a 10 by 12 inch cassette with a grid. It is shot at 72 inches if upright or 48 inches if done on the tabletop. The CR should be centered to T1 and at the level of the vertebra prominence posteriorly.
Try to move the table really quick.
This is easily seen as the thick of the shoulder. A 3 to 5 inch cutted angle can be used to separate the shoulders more. Collimate down to include C5 through T3. Open more per hospital protocol.
Okay, so same thing. I'm gonna have you breathe in, breathe out, and hold, okay? Then you'll be all done. Breathe in for me, and breathe out, and hold. So for our last image of our swimmers, I'm gonna select lateral T-spine, and I'm actually just gonna increase the mass here to about 79. So we'll use 100 kV at 79 mass. X-ray. This is an image of an APT spine. Overall, this is a good image. The exposure is appropriate for the patient. You can clearly see C7 to L1. There is no evidence of rotation and the intervertebral joint spaces are open. We are properly centered at T7, however, we can collimate in left to right to focus more on the spine. Our lateral view is rotated as the ribs do not look superimposed and the intervertebral foramina are not easily visualized. However, the intervertebral joint spaces are open. We are centered correct, as you can see, T3 to T12. T1 to T3 will not be well visualized because the amount of tissue at your shoulders. The exposure factors appear to be appropriate, but a breathing technique would have helped blur out the ribs and help you better visualize the spine. Our last image is a swimmer's view. You can see the vertebral bodies and the intervertebral joint spaces of C5 to T3. There is a clear separation of the humeral heads, and the one furthest from the image receptor looks magnified. There is evidence of minimal rotation, as seen by the zygapophyseal joints being superimposed. There is good collimation, and there is no evidence of motion.